Growing up, I remember my stepmom working in the ICU and then later as a hospice nurse. She really emphasizes giving the patients their dignity and making them feel like they're at home even though they're in the hospital setting, and that had a big impact on me choosing nursing. I do love critical care, and I love teaching at the bedside, but I decided I needed to start in the schools because when they get out, they already have the clinical experience. So starting in the university setting, but teaching them at the bedside felt like a bigger impact. And that's how I ended up going back to school to get my master's. I do homeschool my kids. My son likes to tell everyone that I was homeschooling too while I was finishing my master's degree. But as long as I had a Wi-Fi signal, I could complete my assignments anywhere. And I pretty much did. As an emergency room nurse, we don't ever have time to really stop and break down whatever scene we just lived. We just have to shove it to the back and keep going. And that was my teaching philosophy the entire time. We would talk about the critical thinking skills, and I never really delved into that affective domain. So online education in my master's degree really helped with that and really let me connect to my students more too. Like, how did that situation make you feel? Getting my master's degree through APU taught me that I'm still learning that aspect. And it was really exciting for me to see that American Public University participates in Reese Across America because it's something our family has been participating in for several years, and seeing that service side was a big draw to American Public University. My father is a retired veteran, and it means a lot to teach my son and daughter really to honor our fallen servicemen. If I can teach just one of my students to stop and think before they're giving care or before they make that judgment for their patient, then I know I've accomplished my mission of empowering nurses to provide holistic nursing care. That's really why I do what I do and what I hope for the future of nursing. My name is Rebecca Gabriel, and I'm an American Public University graduate.